O Diyos aming Ama, ang lahat ng nilalang ay marapat na sumamba sa iyo. Higit sa iyong mga biyaya, sinasamba ka namin dahil ikaw ay ikaw. Lumalapit kami sa iyo, dakilang tagapaglikha, nagsusumamo at humihingi ng kapatawaran. Kami ay nagkulang at nagkasala. Patawarin mo kami sa katigasan ng aming mga puso. Turuan mo kami at dalhin sa inyong kalooban. Tingnan mo kami ng may awa at kahabagan. Hilumin mo po ang aming bayan, ang aming mga mahal sa buhay, kaibigan, kapitbahay, karatig bayan, ganon din ang aming mga kaaway sa pandemyang kinahaharap namin sa COVID-19. Isama niyo na rin ang mga may sakit sa iba't ibang karamdaman. Panginoon, balutin mo kami ng inyong kaluwalhatian. Itago mo kami sa lilim ng inyong mga pakpak laban sa anumang kapahamakan o wala sa oras na kamatayan. Kristo, ang tinapay ng buhay, alalahanin niyo po ang mga namumuno sa aming bansa, ang mga ilaw at haligi ng bawat tahanan, at mga kawani na nagtatanggol sa aming seguridad at mga frontliners. Batid mo, Panginoon, ang mga dinaraanan at bawat ganap sa aming buhay. Espiritong Banal, aming tanggulan at gabay, imulat ang aming mga mata at ipakita si Jesus ang Panginoon at tagapagligtas, ang nag-iisang katotohanan at tanging daan tungo sa Ama. Wala nang iba. Purihin ka, o aming Diyos. Ang presensya mo ay tunay na biyaya ng aming buhay. Ito ang aming samot panalangin sa pangalan ni Jesus, Kordero ng Diyos na nag-aalis ng kasalanan ng mundo. Amen.
Reaching out to Filipinos worldwide, the now of digital entertainment with studios in Manila, Bacolod, Hong Kong, and Los Angeles, California. This is V81 Radio Worldwide.
V81 Radio, V81 Radio. Ito ang radio mo, ito ang radio ko. V81 Radio, V81 Radio. Dahil mahal namin kayo. V81 Radio, V81 Radio. Para sa inyo ito, V81 Radio.
The views and opinions expressed in the following program are those of the program anchors and producers and do not necessarily reflect the policies and position of this station. Isang makabuluhang talakayan patungkol sa ating kalusugan, kaligtasan at kagandahan. Kay Ate Doc lang yan. Mga taong kaalaman at napapanahong usapin para sa pamilyang Pilipino. Siyempre, si Ate Doc yan. Kaya mga ka-wellness, andito na si Ate Doc, Sheryl Palad, upang bigyan tayo ng tamang kaalaman sa ating kalusugan, kaligtasan at kagandahan. Si Ate Doc na. Dito lang yan sa V81 Radio Worldwide.
Hello! Biyernes na naman po at masayang-masaya kami dahil kapiling na naman namin kayo at kasama po natin kayo dito sa V81 Radio Worldwide, 1 p.m. at ang kasama natin is Miller's Aesthetic and Surgical Clinic together with Dr. Rodante Miranda.
Hello, magandang hapon po sa inyong lahat. Once again po, Dr. M po, kasama ni Ate Sheryl Palad po dito sa kanyang portion ng Ate Doc. So, sa lahat po ng mga televiewers and listeners, mga supporter ni Ate Doc, magandang
Okay. It's Friday, Ate Doc Time. Kalusugan, kaligtasan at kagandahan. Kasama niyo po kami dalawa. Okay. It's a very, very special episode po because we have a prominent scientist who will be with us and will be introducing a very special health and wellness upgrade for us. Kaya po, mag-tune in lang po kayo because not only yung mga kababayan natin, Doc, we would like to greet our kababayan and mga ka-wellness from Dubai, Middle East, yung mga kababayan natin from Australia, Hong Kong, and also Malaysia, at syempre, yung mga kababayan natin from United States of America. Isang magandang araw po sa inyong lahat. Isang magandang tanghali po dito sa Pilipinas sa mga galing po from Mindanao, Visayas, and Luzon. Maraming salamat po at
Mabuhay po kayong lahat. Yes.
sinasamahan niyo po kami. Ngayon po para po sa ating discussion about kalusugan at kaligtasan. Doc, ito na po, no, nagpre-prepare na po ang ating pamahalaan, ganun din po ang ating mga kababayan at ang piling mga malalaking ospital sa ating bansa para po sa ating bakuna. Tama, Doc?
Yes.
Mm-mm.
At sinwerte po tayo dahil nakasama ang pinagtatrabaho kong hospital sa unang mabibigyan ng vaccination ng mga bakuna. So, nagpe-prepare na po ang hospital na pinagtatrabahuhan ko ngayon kung paano sila mag-vaccine, nagpa-practice na sila kung saan nila ilalagay ang mga vaccines, kung saan lugar nila ilalagay yung vaccination area.
Okay. So, ito po in preparation po para po sa ating mga Pilipino, marami pong mga proseso po na ginagawa, no? So, natapos na po tayo sa proseso kung ano po yung napiling bakuna. Ganun naman po, ang ating pamahalaan naman po ay nandyan na po sa ating mga ospital, sa pangunahing mga ospital po ng ating bansa para po mag-reach out sa ating mga frontliners and health workers para po sa tama pong pagbabakuna at paano po yung tamang handling ng mga bakuna, Doc. Kasi very, very special and very expensive, to be honest, itong vaccine na to. So, we don't have, as much as possible po, wala pong error po sana, window of error to para po sa ating mga Pilipino itong pagbabakuna na ito. Okay, Doc.
Kaya hanggang ngayon, so habang wala pa yung vaccine, practice na sila para perfect ang maging kalabasan nito mga natin, walang sasablay, kung magkaroon man ng komplikasyon, ready ang hospital, kung saan nila dadalhin. So, meron kasi mga ibang tao na, syempre, hindi mo maiiwasan na magkaroon ng reaction sa gamot na i-inject sa kanila. So, pati yun, nakalatag lahat yun, kung saan nila dadalhin, kung paano preparation, at kung paano execution nila.
Okay. So far, alam mo, Doc, binalitaan ako ng mga kababayan natin from other countries. Like in Dubai, my friend tayo, I would like to greet Miss Yuri. How can I say? Yuri or Miss or my darling Yuri from Dubai na nabakunahan na po siya, nabigyan siya ng first dose ng COVID vaccine in Dubai. So, health worker siya dyan. And also, we have yung ating pong mga kababayan also from states, pangalawa na po nilang dose yung COVID sa Amerika naman. So maganda po at maganda po yung kanilang resulta.
Yes.
Okay. So far wala pa naman pong nabanggit na meron pong ibang kakaiba po na pakiramdam, hindi naman po sila nahirapan, hindi po nagkasakit right after. Sana po ganun din po dito sa atin sa Pilipinas.
Kaya
Okay?
po yung mga nagdadalawang isip dyan sa mga frontliners, kung gusto nilang magpa-vaccine or hindi sila magpa-vaccine, mas maganda po siguro para sa akin na magpa-vaccine na tayo para protektahan din natin ang pamilya natin kung uwi tayo para hindi tayo mahawa. So maging example tayo sa government natin na sumusunod tayo sa mga patakaran ng mga QAs.
Okay. So, Doc, balitaan mo lang kami, konting konting insight lang po. So, yung Tala po, yung hospital sa Quezon City po.
Tala is lugar po yan.
Opo.
Yung
name ng hospital is?
Dr. Rodriguez Memorial Hospital. So, isa siya sa mga 4 na hospital na mabibigyan ng initial ng vaccine sa pambansa.
Okay. So far, Doc, pinapirmahan po kayo? Paano po, ano pong nangyari?
Ang ginawa, siyempre, nag-survey muna kung sino yung mga kung sino yung mga may gusto at may mga ayaw magpa-vaccine. Siyempre, yung health status mo, inaalam mo na kung may mga comorbids ka ba para at least prepared tayo kung ano nangyayari.
Okay. Yung comorbid sa mga ka-wellness natin, Doc, is yung
Yung
mga...
mga may hypertension, diabetes, o may mga ibang karamdaman sa katawan. So, kaya inaalam na din natin ito para at least prepared nga tayo.
Ayun, sige po. Pwede po ba nating makita po yung mga picture po na in preparation po ng ating gobyerno para po sa pagbabakuna? Can we have it? Okay, ayan po, no? Ito po, nagpre-prepare na po ang ating pamahalaan for these facilities. Kung makikita niyo po, may mga nakalagay na po na mga vaccination area, observation area, kumbaga, inaayos na po talaga. Tapos yan po ang ating Department of Health Secretary na umiikot para po dito sa ating preparation for the vaccine. Okay? So, yan. Doc, sa ospital niyo po, may mga ganito na po tayong
Oo.
preparation?
Actually, umikot na din ang DOH sa hospital namin noong nakarang araw. So, nabalita na yan sa ibang balita. So, maganda naman ang kinalabasan at prepared na prepared talaga ang Dr. Rosén Rodriguez Memorial Hospital para sa vaccination natin. So, nagpapasalamat tayo sa tulong ng mga trabahador o nagtatrabaho dito sa Talas. Nagpapasalamat din tayo sa masipag na nating director, si Dr. Pamaran. Well coordinated lahat ang bagay na nangyayari dito sa Dr. Rosén Rodriguez Memorial Hospital.
Okay. Kung may mga katanungan po, kung meron po kayong gustong malaman o kaya po, meron po kayong gustong i-share sa amin po regarding po dito sa upcoming vaccination po natin, you can type it in po sa aming mga messenger, no? You can visit our pages and baka may mga sasuggest kayo for the upcoming discussion po natin dito sa ating pong kalusugan, kaligtasan at kagandahan kasama si Ate Doc at si Doc M. Okay? So moving on. We would like to introduce to you our very special guest for today. He is the leading and top name for regenerative medicine and a well-known trainer, CEO and president of StemGenn and StemMax, and also the president of International Association of Stem Cells and Regenerative Medicine, with 15 years of excellent studies and journals for regenerative medicine, including the field of gynecology, in the field of surgery, and even orthopedics and wellness field. So, Doc, we would like to introduce to you our very, very special guest for today, Prabhu Mishra.
Yes.
Hi.
Hello.
Hi, good day, sir.
Good afternoon,
Yeah,
sir.
good day.
Yeah.
Okay.
Let me introduce myself.
Good morning.
Dr. Rodante Miranda, sir.
Good morning from India. Good afternoon to Philippines. And apart from that, good evening, good morning, and good day all across the world, beloved friends.
Okay.
Yes, sir. Sir.
So, probably not only Filipino are watching this time, because as a certified guru and mentor of regenerative medicine, probably most of the leading names in their specialties are here with us, because of course they want to hear most of your knowledge that you want to introduce the regenerative medicine and stem cells for our health. So,
Yes, sir. There's a lot of Filipinos listening to BA1 Radio, sir. Would you like to tell about something about the stem cells, sir? The benefits of stem cells, or do you get it, sir?
Sure. First of all, I'd like to thank you, Dr. Sheryl and Dr. Dante, Dante, for inviting here. And I'm just a learner. And because nothing is, no one is expert in this world, especially in the challenging subjects, which are most debatable, most progressive, and it's a continuously progressing. Every instance and worldwide, the scientific group are working on that. And we are one of the small group which are also working on stem cells and regenerative medicine for more than a decade. And we have a wonderful team for that. And I'm thankful to everyone here and all audience, Dr. Sheryl, Dr. Dante, and all of our friends. So first of all, public, because most of the time people debate about is stem cells really working or not? What exactly it is? Like Dr. Dante recently asked public want to know what exactly is the stem cells? Is this really hype or hope? So see, if you'll see the stem cells currently globally for hematopoietic conditions, that is blood-related disorders like thalassemia, sickle cell anemia, aplastic anemia, and many other cancers. These are in proven categories like hematopoietic stem cell transplant. There is medical education, regular education like MD hematology and transfusion medicine. So, especially hematological indications are proven category. Few countries have also approved for limbal stem cells. And apart from that, majorly if you'll see, because stem cells, there is a many synonymic words, especially stem cells, cell-based therapy, regenerative medicine. These all words have different meaning and a different, it defines different other things. Stem cells is a pure population of cells. Either it's a hematopoietic, either maybe it's a mesenchymal, or either it's from the any specific tissue derived. It may come from your own body. You may require the donor sometime for some disease. You may require sometimes to culture the cells. So it depends which kind of indication doctors are targeting. But the thing is, majorly, the indications are currently experimental in clinical trials. People are using sometimes as per their own regulators on the compassionate use, but it depends which kind of indications, what kind of cell source we are using. Because sometimes we mix with platelet-rich plasma. Platelet-rich plasma is one of the cell-based therapy. It's not an stem cells. Sometimes it's a tissue engineering products like scaffold base, hydrogel, and many others like autologous chondrocyte implantation for orthopedic uses. So these all have their own meaning, own kind of indications, own kind of disease and applications. Yeah.
Me, sir, because probably most of the audience they were thinking that stem cells are only for intravenous infusion, and most of the people that can afford it are those belonging to um, A and B, and those who have money to sustain this stem cell therapy. But for their information, sir, we would like to tell them that stem cell therapy, regenerative medicine is a very, very broad aspect of medicine that should be introduced, probably, most especially in our country, belonging to third world country, that treatment and procedures and even healthcare is very expensive. I think it would be a good means for us to be trained as doctors in this kind of field. Okay,
Yeah,
sir?
see, yeah, Dr. See, actually, stem cells, Dr. Sheryl, not only for the intravenous use. Actually, if you'll see, hematological indications have given the benchmark for the study. Sometimes what happen, it's not the targeted. Sometimes regenerative medicine called that precision medicine, personalized medicine. But the thing is, we confuse with like it should be the tailor-made or it should be the bottled one, like any other medical drugs. So the thing is, it depends on the indications because it's a cytokine-based therapy. Stem cells is basically it's a cocktail. It's a mixture of specific growth factors, specific cytokines, specific progenitor cells. which may be the tissue based, maybe the cell based, but it possesses the property of self renew. It possesses the property of differentiation. It can differentiate into the targeted cells or the tissues. So intravenous is not only the treatment with stem cells. Like, let's say an example, if someone is treating for age-related macular degeneration, some of the clinical trial data, you need to go the intravitreal injections. If you're targeting the osteoarthritis, you cannot give the intravenous. You need to go for the intra-articular or maybe the peri-articular or into the patellar fat pad or transpatellar as per the orthopedic suggestion, respective orthopedic doctor suggestion. Similarly, if you're treating for the non-healing ulcer, like platelet-rich plasma, you have to go inside the wound or the alongside the wound. So depends on the indications, the route of, because still, because that's why this subject is still in under the clinical trial, considered as an experimental most debatable subject. Reason is that route of administration, which kind of cell source, which kind of what should be the cell dose. These all are not yet uniform. If you even search the PubMed or any research site, you'll see, like, none of the protocol, you'll find a uniform protocol even for the platelet rich plasma preparations, even for the cell culturing of the stem cells. So that's why still it's in a very initial stage. It's showing the great promise for many of the indications. If you'll see the global regenerative medicine market of the 2019, it was around 18 billion or above. And at the CAGR, it's increasing around 22%, and it's expected to the many thousands of the $1 billion across the globe, and it increasing day by day.
So probably, sir, if we may ask you about having this stem cell and regenerative medicine in practice in clinics. Do you think it would be an advantage for us belonging to, of course, those who are needing this kind of procedure, not particularly for age-related, but also in the other field like gynecology, orthopedics, or even in surgery. Do you think, what's your opinion for having this stem cell in
Clinic.
practice in clinics?
Or is there any
See,
ideal setup for the clinic to build a stem cell clinic, sir?
sir, see, if you'll see the stem cell into the clinic, as I told you, like very limited indications have been proven for the clinical practice. Clinical trial is permissible across the globe. And it should be always should be the science backed up. It should be the evidence based medicine. Prior to approaching to the patient, we should do some of the animal based study. But currently, if you see the terminology regenerative medicine, most of the time we will use the regenerative medicine. A stem regenerative medicine is not only a stem cells. It encompasses with the cell based therapy, tissue engineering, medical devices, many regenerative compounds like granulocyte colony stimulating factor, IGF-1, IGF-2, growth factor-based therapy. Nowadays, many other new molecules to the area combined with like nanomedicine, like nanoparticle-based drug delivery system like exosome. Then genome editing tools. This year, Nobel Prize goes to for the genome editing tools. So many other advances coming to this field day by day. But like autologous minimal manipulation, same sitting surgery is allowed or permitting some of the countries' regulators. So we'll have to check their own regulators of the respective country, what kind of regulation there are they allowing. Autologous minimal manipulation, same sitting surgery means autologous means patient is itself a source of the stem cells or the cells you are targeting. Minimal manipulations, you are not adding any kind of enzyme, you are not adding any kind of chemicals, or not culturing it, not expanding it to modify their basic nature. And same sitting surgery means the transportation of cells is not permissible. Patient is there itself, and you have just concentrated, centrifuged it, and prepared it, and you have given to the patients. Like if you'll see the bone marrow, bone marrow is widely accepted for hematopoietic indications. Nowadays, many clinics, many research papers have shown the safety and efficacy for BMAC therapy, bone marrow aspirated concentrate therapy, for many orthopedic and non-hematopoietic indications. Similarly, like fat grafting. Fat grafting is a lipoaspirate-based product like liposuction done by the plastic surgeon or dermatologist, and after that, it goes to the lab. They prepare the micro-fragmented adipose tissue, or the sometimes people also call the nano fat. It's a homogenized adipose particles. And stromal vascular fraction. So these all are currently practiced. But simultaneously, if you are going for the mesenchymal stem cells, mesenchymal stem cells you can only obtain by the culturing of the bone marrow or the adipose tissue or the dental pulp or the umbilical cord tissue, because of more than minimal manipulations. If you are using the mesenchymal pure population, you need to go for the clinical trials, because definitely, because it possesses the anti-inflammatory, anti-apoptotic, anti-fibrotic properties. So it's a strong regenerative compounds, and prior of that, at least we should have the safety studies before administering to the patients. But autologous minimal manipulation stem setting surgery is nowadays practiced worldwide in many clinics.
Okay.
Yeah, thank you.
Mga ka-wellness, I'm very fortunate enough to be trained under Dr. Mr. Prabhu Mishra, our president
Guru.
and guru and mentor. And it's a good application also here in our aesthetic and surgical clinic, because we do have procedures that encompasses this regenerative medicine, including the very, very basic use of PRP that we have gained a lot of advantages while using it in aesthetics. Dr. Dante, we are using PRP, right?
Yes.
How about in the wound care?
Actually, the wound care, they are also using
Mhm.
PRP already. So they are they are incorporated the blood to the wound.
Wound.
Yes.
Okay, so
Better wound healing.
yes, this is a good advantage of you visiting us together with Dr. Dante here in our clinics here in Manila, in Quezon City, and in Pampanga, because we are into regenerative, using regenerative medicine as mentored by Prabhu Mishra, because we are into, how do you call this one, sir? Stem cell based therapy to help those who are needing this kind of procedure in advances, either for medical, surgical, or even aesthetic advances or procedures, sir. Okay, sir, may I ask? There's a question here. Um, may you ask?
How stem cell industry
Yeah.
impacting human health, sir?
See, if you'll see the key factor here, uh, the key factors propelling the growth of the global regenerative medicine markets are increasing adoption of stem cell technology, gene therapies, and tissue engineering, and the technological advancement in regenerative medicine. Many of the hematological indication-based drugs are in the market nowadays. From if you'll see from the orthopedic indication to hematological indication, many cell-based product even in the market nowadays. From the some of them like Apligraf, Keytruda, then like earlier Propenge, dendritic cell-based therapy, and many other into the market. I don't have any conflict of interest to any of them, but just generally, if you'll see these products, you will find out into the Google there are thousands of products on the cell-based products into the market, and more than 2,000 clinical trials are going on, which are on the brink to bring many of the products for many of the indications. And it's a it's a rapidly developing technology that play a major role in human life. And many of the biomaterials, biologics, these all are coming indication based. If you'll classify from the disease to even the specialty wise, major players, if you'll see the industry like Organogenesis, Elan, Integra, Cook Biotech, Osiris, many others. Even our team is also doing great, good work here. So many of them, if you'll see, the future will be the regenerative medicine. And we cannot say it's a future. We are moving very fast. It's maybe the present. Regenerative medicine is going to impact on the human life like anything, because we all want somehow as a preventive medicine. We all, we called it today, if we'll not focus for wellness, tomorrow definitely we are going to force to focus for the illness. So definitely the regenerative medicine is a boon for the science, and probably this is going to transform the uh, human healthcare industry.
Okay. Sir, if you may, where are we in stem cell therapy for regenerative medicine? Where are we in regenerative medicine for as a therapy? Is it still in clinical trials or there are proven,
See,
sir?
I told you, like, yeah, yeah. I told you in my very first question, like stem cell therapy for hematological conditions are proven category across the globe. And apart from that, autologous minimal manipulation cell setting surgery, the best terminology you can say like cell-based therapy, is somehow most of the country have permissible. Some of the country are also doing like mesenchymal stem cells, but definitely the clinical trials. We should all medicine runs on the ethics and the research. Then only the solid evidence-based and backed up medicine, evidence-based backed up medicine will be there. So that's how the basic research, clinical trials, it's always appreciable to do. And it goes through most of the indication are still under the clinical trials only.
Yes, sir. There's one question here. Doc, can you ask that one? Okay. Um, do we have any correlation of regenerative medicine therapy this
For
time
COVID.
for COVID?
See, for COVID, uh, few groups have registered the trials. Even if you'll see the Abu Dhabi group, they have started with the mesenchymal stem cells, and many of the paper, if you'll see as a convalescent plasma therapy have given widely in majorly across the globe, people have tried with the convalescent plasma therapy. The convalescent plasma therapy is definitely not a platelet-rich plasma therapy. That's a different from harvesting the convalescent by one of the method called FRSS by the plasma exchange method. So there is a difference between the plasma therapy and the convalescent plasma therapy. But you'll see the mesenchymal stem cells clinical trial have been registered, even if you'll find on the CTRI on or many other research-based site in the PubMed as well as in the Google Scholar. So if you'll see there, so mesenchymal stem cells, one general hypothesis is that because mesenchymal stem cells possess the property for immunomodulations. It works like a strong antifibrotic components, anti-apoptotic. So definitely there is a hope with mesenchymal stem cells to prevent from the ACE2 receptors or the immuno. It will act as an strong immunomodulators.
Okay. Sir, we would like to reiterate that regenerative medicine and stem cell therapy is not only for purposes of medical procedure, but with this also, it was introduced also for aesthetics. If you may, sir, we have other hands-on training and data that we use regenerative medicine in the field of aesthetics, sir.
Yeah, of course. Many see, aesthetics is, as I told you, like regenerative medicine. We should first of all should be very clarify stem cell based approach or regenerative medicine. Regenerative medicine contains many things. Regenerative medicine is not only like bone marrow transplant or hematopoietic stem cell transplant. The source may be the amniotic fluid, maybe the cord tissue, water and jelly, dental pulp, maybe the adipose tissue, and PRP, platelet-rich plasma, or PRF, platelet-rich fibrin, wherever you require the volumizing effects. And Many other biologics like fat grafting, even microfragmented adipose tissue or nanofat. Nanofat is ideally in commercial terminology. We call it homogenized fat. So these all are widely used, and as stem cells possess the property of self-renew, that might be used for many other indications. You will see in aesthetics, like from the stretch marks, stria, to the fine lines, front lines, wherever you require the volumizing effects, even for the breast augmentation, buttock augmentations, nasolabial folds, or even nowadays a very booming area, as you are a gynecologist, you all are, even you in your introductions, like you're a certified cosmetic gynecologist. So you all know, like many other genital aesthetics came into the nowadays. Another advances or subspecialties in aesthetic medicine, because earlier we were only focusing for the hair, face, skin. Now it's a genital, like from even whatever you are doing for the face, it's many of the indications it's created there, from the labia augmentation to labia major augmentation, by the fat grafting, by the hyaluronic acid filler, and even Botox for vaginismus. Many group have published the paper, as well as like PR, platelet-rich plasma for vulvovaginal rejuvenation, for the energy-based devices, like CO2 laser or BMEAG or radio frequency, even high intensity focused ultrasound, carboxy, and many other advances came. Yep.
Maybe, sir, my colleague here will concentrate on genital
Oh, yes.
regenerative medicine for men here in our country.
I will contact you, sir.
Yeah, of course.
Okay.
See, we always call it why this aesthetics only meant for the female. Nowadays, even if you'll see in the majorly, even we have seen in our country, in most of the clinics, in most of our doctor friends, the number of male patients in aesthetics are increasing day by day. And see, everyone wants to be in glamour. You know, why only female needs time for the aesthetics? Everyone requires that. And apart from that, if you'll see the cosmetic gynecology, many people in the world nowadays have started cosmetic urology, cosmetic andrology, and many, even if you'll see the apart from that, like pinoplasty is from decades people are doing for the penile enhancement, pubis liposuction, for the better appearance, girth enhancement. So many other advances came day by day. So definitely the men's wellness. See, aesthetics is complete when our society should focus for both the men's wellness as well as the female wellness. And these all are like inherent pillar of the societies, and it should be focused on both.
For that. And it's very, very fortunate for us to hear this one from you, because as we wanted to share it to our ka-wellness and the other people there, that in our field of doing aesthetics and cosmetics, it's more of um, based on what is clinical and what is proven to help people in our community, also in our country, through your effort in teaching us this regenerative medicine, sir. So hopefully we can see you again, sir, in this coming updates of aesthetics, cosmetics, and even in the field of
Surgery.
surgery, sir.
See, many advances nowadays coming, because regenerative medicine is one of the area, because many indications where current medical practices, even sometimes you are stuck with many autoimmune conditions or many even surgical indications. If you'll see, like, even I'll give you the example of a very simple example of the diabetes. Type 1 diabetes, till date we take insulin, we survive. Stop the insulin, what next? Either lifestyle management, or either it increased day by day. Where we are in diabetic management, where we are in liver cirrhosis, where we are in ulcerative colitis, where we are in Crohn's disease. So these all things are definitely like this kind of indication. Even if you'll see the immunotherapy coming up as an advancement, like dendritic cell therapy for prostate cancer, few products are into the market. So similarly, this kind of indications, surgical indications, where you require regenerative medicine interventions, and if you search the clinical trials, many advances into this kind of indications. Even in the orthopedics or spine injuries like spinal cord injuries, or even the osteoarthritis, avascular necrosis. But the only thing you need to check with the inclusion criteria, exclusion criteria being clinicians. Is this patient is appropriate or not? Is or either there is a product into the market, or what's the registered clinical trial says about it. You should have some kind of pilot study. This all gives you, like, and apart from that, many people think for, like, cross practices, cross specialty practices. No, you should have involve your own, like those who are orthopedic, they should stick to the orthopedic indications. Those who are gynecologists stick for the gynec indications. So these all are currently challenges with these pills. And some of the indications which are not meant for stem cells, never think for that. We have many, it's so valued for the ethics and research.
Okay. So, sir, um, maybe this upcoming episodes that we're going to have, such as we're going to discuss procedures from aesthetics and cosmetic procedures, that we can also include regenerative medicine. For example, sir, like for in my field, I'm doing the fat grafting in genital area. It can be combined with regenerative medicine using this PRP and also the bone marrow aspiration that we have that can be used for gynecologic purposes. Hopefully, sir, we will try to have the list of our cosmetic and aesthetic procedures, and perhaps we can ask you again to have some insights in for the advancement of our procedures, I guess.
See, if you'll see here, nowadays a revolution is taking hold in medical aesthetics. Either increasingly the use of stem cell therapies in advanced fat grafting, as you rightly said, and volumization technologies like platelet-rich plasma or PRF, platelet-rich fibrin matrix, or stromal vascular fractions, growth factors, and other tissues and cell-based techniques are starting to replace a need for more invasive surgery, as well as drug or chemical based treatments. These new approaches to anti-aging or rejuvenations or wellness, which use the patient's own tissues and blood for repair and regeneration, are already in use within urban wound care specialties, orthopedics, and are poised to revolutionize the entire medical industry as technologies and techniques improve and gain revolutionary approval. So day by day, these signs are increasing. And many research came into the picture, like it giving now into not only the procedure, it coming as of the products. So many, apart from the aesthetic indications, even into your cosmetic gynecology, if you'll see the stress urinary incontinence, interstitial cystitis, vaginismus, where you require something, what you can do in interstitial cystitis. So these all indications need some kind of pilot study, where even we need to a support of the clinicians, our researcher team need a collaborate. We can work into the collaboration for this kind of studies we can do as a pilot across the globe. So these all things are many challengeable indications, as well as the approach. We can move this science ahead and bring some advances to the society.
Sir, you already discussed everything, sir. The benefits, the who will benefit it, where will you get it, sir. For that, sir, we will like to thank you again.
Yes, sir. So probably that's it,
Yes.
Dr. Miranda. We will be asking you once in a while, Prabhu Mishra, for our consult in every procedure that we're going to do. So hopefully we can have fat grafting assisted by data of regenerative medicine by next week or succeeding weeks, sir. So thank you for gracing our day here in Ati Doc episode.
Thank you so much. Thank you, and wonderful being here. It's a really pleasure to be here and interactions and whatsoever. It will be a great help again to be here for all of us. Yeah, thank you. Thank you for inviting me today.
Yes, sir. Can we invite again, or do you have any other words of invitation for the upcoming trainings, hands-on, or even say hello and hi to our dear colleagues from IASRM?
Yeah, see, we are having now, as we know, we are known for the training in stem cell and regenerative medicine, Dr. Sheryl. Dr. Sheryl is also Secretary General of International Association of Stem Cell and Regenerative Medicine. So if you'll see, our date is already announced, or we are inviting the applications for fellowship in stem cell and regenerative medicine, as well as we do have diploma in cosmetic gynecology. So it will be definitely great to see you all there.
Hope to see you. Thank you very much. Thank you.
Thank you. Thank you. Thank you. Thank you. Thank you.
Ayan, ka-wellness. Ang gusto lang namin sabihin sa inyo mga ka-wellness ko, na ang mga procedures o ang mga ginagawa po namin dito sa aming practice as aesthetic and cosmetic procedures po ay guided by science, no? So, hindi po pag sinabing stem cell po, ang stem cell po ay para lang po pampaganda, hindi lamang po para sa mga nakakatanda. Pati po sa mga procedures namin, no? Yung during liposuctions, no? Di ba? Tama ba? Yung mga wound healing na yan, yung mga PRP, no, pampaganda ng kutis, no, pampaganda ng contour ng katawan, lahat yan po nakukover ng ating tinatawag na regenerative medicine. Ayan. Kaya, mga ka-wellness ko, let's have a break and then pakita namin sa inyo yung Puso Month, no? Yung ating tinatawag na Health and Wellness Goal promo for our Belarus Aesthetic and Surgical Clinic. Let's have a break.
Magbabalik si Ate Doc. Dito lang yan sa V81 Radio Worldwide. A spirit-filled song that talks about healing from the Lord Jesus Christ, our great healer.
Nasasaktan, kumikirot ang aking puso.
Hilumin mo awit ng kagalingan at pagsamba by Felsen.
Hilumin mo ang sukat ng aking puso.
Digitally available everywhere and here on V81 Radio.
Bigot pagturo ko dahil lang ngayon at ang bukas.
Good news para sa mga kababayan natin abroad. Mapapanood nyo na ang inyong mga paboritong V81 radio shows sa Amazon Fire TV. Simple lang ang gawin. Hanapin lang ang V81 TV app and install. Tiyak na wala kayong mamimiss na episodes na gusto nyo dahil mapapanood nyo na ito anytime and anywhere you want. Gamit ang Amazon Fire TV. Tandaan lang, just install V81 TV app and you're good to go. Another first from V81 Radio Worldwide. Pag 7 p.m. na, dapat naka V81 na. Catch these programs at 7 p.m. Pacific Time. Talk Shop Asia Global, USA Edition with Rolly Pagaspas and Rosario Cajucom Bradbury. Home Not Alone, Songs from Home with Papa Gio. It's all about entrepreneurship and entertainment. Back-to-back programs at 7 p.m. Pacific Time. Tuesdays and Wednesdays, LA at 7. Exclusively on V81 Radio, Los Angeles.
Hi, this is Jaya. Pinoy music ba hanap mo? Well, download the V81 Radio mobile app available at the App Store and Google Play Store. Free now, free forever. Ganun!
Ito ang paborito ng bawat Pilipino. Basta all hits, all Pinoy, panalo. Merong kwentong iyakan at tawanan. Kahit nasaan ka man, ito'y mapapakinggan.
balikan na natin si Ate Doc. Dito lang yan sa V81 Radio Worldwide.
Okay, mga ka-wellness, ito na naman po kami. So don't forget po, kung meron po kayong mga na-miss na episode po na sinusubaybayan nyo sa V81 Radio, you can download our free app, Doc.
Yes, download nyo lang po ang app namin, Ate Doc sa V81 Radio, para mapanood nyo yung mga na-miss nyo yung discussion ni Ate Doc with Sir about the stem cell. So,
Huwag niyong kalimutan ha, mga ka-wellness natin from abroad. If nami-miss niyo po yung mga kababayan natin from here, your families, your loved ones, just download our free app. Very, very free. It's free now. It's free forever. Download the V81 Radio app para makita niyo si Doc Dante.
para makita.
Okay. Alam niyo ba mga ka-wellness, Pebrero ngayon, Doc, it's Love Month, sabi nga nila. So, kindly greet your wife na. Say, Love Month na.
Hi.
Hi daw, Mrs. No? Okay. So, yan po This is February and Love Month po. Kaya po, ini-extend po namin dalawa ang aming pong services with you under Miller's Aesthetic and Surgical Clinic and also StemGenn po Wellness Clinic in Pampanga. Meron po tayong tinatawag na health and wellness goals for couple. So, Doc, ano ba yung health wellness goals na yan? Ano yung kasama doon sa health and wellness
Yung
goals
pakita
na
natin,
yan?
sinabi natin kanina.
Ano yan? Sige, sabi mo sa
Siyempre,
kanila.
bago kayo pumasok dito sa amin, antigen testing.
Okay, that's health.
Yes.
Antigen testing, we secure that you are healthy. That's why we're doing the antigen testing. And then,
Number 2, immune system. Boost yung immune system by IV drip.
yung IV drip natin, meron po tayong immune boosting drip dito sa Miller's at sa StemGenn. So, yun nga po yung immune boosting drip natin. And then, yung
At
pangatlo,
yung
Doc.
facial with Ate B and Dr. Palad.
Ayan. So, alam nyo, yung aming pong package and wellness goals, health and wellness goals for couple this month includes health, wellness, and beauty. Siyempre yung health, check muna natin kung kayo po ay COVID-free using the antigen testing. And the second one is the wellness wherein we give yung pong tinatawag natin immune boosting drip para po secure kayo, healthy po kayo, lalabas dito sa amin, guided by Dr. Dante and Ate Doc. And also, we have the beauty for your facial. At Doc, ang good thing dyan.
Hindi lang tayo. Siyempre, nandiyan din yung mga kasama natin.
Yes. Sige nga, pakibati ang ating mga
Pinabati ko yung mga kasama natin. So, Miller's, Dr. Mark Cruste, and Dr. Loris De Jesus. Sana come and join us.
Yes.
Every Friday here.
Opo. Ayan po. Ang Miller's po includes the name of Dr. Miranda, Dr. Loris, Dr. Ruste. And syempre,
the letter
singit.
S. Yeah.
S na singit.
S for singit is Dr. Sheryl.
Okay po. Yun po, yun po ang ating pong health and wellness goals po for 2021. So if you may, can we play yung ating earlier recorded video about our couple goals for 2021 here at Miller's and StemGenn Clinic, sir?
Hello, good afternoon to everyone. Welcome to Miller's. Ate Doc.
Hello po, good afternoon. Good day to all of you. Ate Doc po, Dr. Sheryl pala, together with Dr. Rodante Miranda.
Dr. M. Yes.
Nandito po tayo ngayon sa Miller's and we are very happy to tell you that this February, the Heart Month, meron pong magandang promo po ang ating Miller's Aesthetic and Surgical Clinic for our couple. So, hindi lamang po yung mga early ages, kahit na po ang ating mga tito-tita, ang ating mga ate, pwede pong pumasyal dito sa amin sa Miller's Aesthetic Clinic. We have this health and wellness goal para po sa inyong mga couple.
Yes.
So, ano bang coverage ng health and wellness goal mo daw?
Ang coverage ng health and wellness natin ay mga sumusunod. Number 1, antigen. Of course, bago ka pumasok dito, kailangan ma-test mo na ng antigen. And then number 2, drip. So, para saan bang drip natin, Ate Doc?
Okay, we have this immune boosting drip po na para po sa ating health. Kaya po pag pumasyal po kayo dito, sigurado po na you are COVID-free with our screening and also our immune boosting drip. At meron pang special
Yes.
dyan, Doc. Ano yung special?
Si Ate Doc, ipe-facial kayo. Yes, yun po. Hanapin nyo si Ate Doc, siya mismo ang magpe-facial sa inyo. Yun po ang mga kasama sa package ng ating couple package.
Ayan, may couple package po tayo dito sa Miller's Aesthetic and Surgical Clinic. Don't forget, it's health and wellness goals for couple, no? 2021. So, meron po kaming bisita dito. It's my auntie and my uncle. They will avail our health wellness goal for today. Yung health wellness goal na yan, syempre, initially, we will have the antigen testing. And pangalawa, yung kanilang health and immune boosting drip at yung
Ang inaabangan nila, yung pagpa-facial ni Ate Doc.
Oh, sige.
Yes.
We'll see that. We'll see that. Okay.
Bye.
Ayan.
Sorry, namuli niyo pa ako.
O yun, pwede pa natin ipakita din kung paano natin naman ginagawa yung antigen testing dito sa atin po sa Belarus. Kasi po kinakailangan yan, no? As a health protocol po, we want you to be safe while visiting us here in our clinic. Ka-wellness, dito po sa Miller's Aesthetic and Surgical Clinic, we need to be safe. So, before any procedure, we would like to have an antigen testing. Para po dun sa health and wellness goals natin for the couple, for 2021, ayun po, i-antigen testing muna po natin si auntie. Okay? Sige pa. So, yung antigen testing po natin is nasal swab. Tabako lang po, auntie. Okay, you can cover your mouth from there. Angat lang po. Okay, sorry auntie. Okay, that's it. Okay, we'll just see the result and after that, we can proceed with the procedures. Kasi namin mga ka-wellness po, kung after nun, yun nga no, ginawa natin kanina yung antigen testing and also, nagkaroon sila nung immune boosting drip. Pwede ba natin ipakita yung immune boosting drip na yun?
Okay, Doc M here. I'm going to do it by myself. It's my turn. Sir, pwede po ba tanggal mo? Okay. At tanggal mo. Eh, sarado po nito. Yan po, nakita nyo kung paano gawain. Ganyan lang po kasimple. Then, hintayin natin ang resulta after mga 30 to 1 hour. Ano po natin. So, hindi pala yung booster yung pinakita niyo, sir. Yung pag-swab pa rin natin.
Meron pa tayong isang slide dyan. Dok, pakita natin yung ano po, yung nagre-drip na po tayo sa ating pong couple. Okay, ka-wellness. Maraming salamat. Ito ang health and wellness goal natin for this month, no? February 2021, couple goals natin. Kasama po ang health drip. Itong health drip na to will help my auntie to boost her immune system. Kaya po, wala na po tayong ibang iisipin. Punta po kayo dito sa Miller's Aesthetic and Surgical Clinic.
Bitin.
Bitin na.
Yes. Yung kanina sobra, ngayon bitin naman.
Okay. About dun sa about dun sa male part ng natin, ng immune boosting natin.
Paki-play nga po.
Paki-play nga po.
Meron po tayong play, sir?
Wala na? Wala na tayo play. O sige. Moving on, yung kasama nga naman doon ay yung
Facial.
pag-facial natin.
Facial natin, Doc, at ni Ate B.
Hindi, si Ate B ang naggagawa ngayon ng facial. Kaya isasama namin kayo sa aming
Treatment area.
treatment area. Okay. Sige, sige. Doc, Sandali lang ha. O, sige nga. Pakisuyo nga po ako. Kasi gusto namin kayo ipasyal dito sa Belarus Clinic. Okay. Doc, sige nga po. Proceed ka na.
Yan po, dito ang ating treatment room. So, lagyan na natin sila ng cream. Yan. So, hintayin na lang natin si Ate Doc para ituloy ang facial niya.
Ayan. Ito na ako. So, dito po sa Belarus, no, we would like to introduce to you a complete wellness not only for the young, but also in our middle ages, like our tita and titos. Kaya kung may pagkakataon po kayo, mga tita, tito ko, no, etong February na to, huwag niyo pong palampasin na mag-date kayo dito sa Belarus. Okay? Huwag niyo palampasin yan, ha? Ang ating health goals is also love life goals here at Belarus Aesthetic Clinic. Ayan. Okay. So far, yan po, yung aming treatment room for the facial. And then, we do also have our friends who are here having their health drip. Ayan, ang mga beauty. Ito po. Ayan po. We are live. Ayan.
Hi!
Ayan. They're having their health drip po dito sa Belarus. Okay? So, if you have time, no, please continue ang inyong health and wellness together with us. Ate Doc, Dr. Sheryl Palad, and of course,
Doc M.
Dr. Miranda. Okay. Doc, so, yan, no? Ang bilis ng oras, isang oras na pala tayo nag-uusap, nagkwekwentuhan. So, probably by next week, we can have a procedure naman and together with the video also para masamahan nila tayo. Okay? So, wag pong kalimutan mga ka-wellness ko, you can visit us here. Saan ka nila makikita, Doc?
Siyempre, dito sa Belarus, every Thursday and Friday na po. And also Sunday sometimes. Pwede po schedule. Pwede po din kami visit sa our page. I-follow niyo yung page namin. Meron na din po kami page ni Ate Doc na
Yes. Very happy.
Yes.
Pero babanggitin namin yun by next week, yung aming pong wellness aesthetics. By Palad and Miranda. Okay? So, mga ganun pa rin, mga ka-wellness ko, no? So, babanggitin ko lang po. Upo muna ako. Okay. Halika na dito, Doc. Maupo ka na po. Okay. Always po ayan. So, yun
Ang gulo natin,
Oo, ang gulo natin. Ayan. Inform lang po natin, if you want your procedures po, do your aesthetic and cosmetic procedures under the care of medical doctor. So, yun pa rin po, shy away from procedures or anything like using the devices like machines po na hindi po doktor ang gumagawa. Even if we're doing the procedures po dito, guided po namin yung mga tauhan natin, okay? Yung mga employee natin about that, sir. So, ganun pa rin po. We are praying na sana po, if you have any ideas that we can discuss here in Ate Doc, please, you can type it in and also send it to us para po ganoon, no? Sige, Doc, ano pang mababanggit mo sa kanila?
Ayan po, medyo hirap kami kasi hawak ko yung phone.
Ako naman nahahawak, Doc. Sige po, ano?
Gusto niyo po kaming makita palagi, nandito lang kami. So, may mga affiliated hospital din kami pupuntahan. Like me, I'm affiliated in Dr. Jose Rodriguez Memorial Hospital and also ACE Quezon City and ACE Valenzuela. So, or if you want to message me or contact me, you can message me through my Facebook Messenger, Rodante Miranda, Rodante Miranda, doon po, or you can email me at rodantemiranda@yahoo.com. Yeah.
Okay po, sige po. Ganun pa rin po mga ka-wellness, mga kababayan ko, no? Pinapanalangin pa rin po namin na araw-araw po maging ligtas po tayo, maging maganda po ang inyong kalusugan. Damihan po yung inom ng ating tubig as much as possible. Always po, tandaan po na kung maaari, always wear your mask, doctor, and then your face shield and yung ating social distancing. Pero yun nga, Doc, both of us are negative. We always clean, kaya po, yun po yung ginagawa natin. Wag pong kalilimutan. Kung may pagkakataon din po, Doc, please ask them na may pagkakataon po kayo mag-exercise po kayo.
Kaya lang ginagawa natin every day, every night.
Hindi naman every day, Doc. Medyo every other day. Depende kasi sa
Makikita niyo
availability.
siya sa post niya, nagsasayaw siya, nagsusumba.
Kaya yung mga ka-wellness, no? Kasi ang totoo niyan, kahit na in our age as of this time, we really need to have other activities other than going to work or going home para po maging malusog tayo. Kasi yun lang po yung magiging protection natin para malabanan po yung ating COVID.
Yes,
Okay?
para ma-protection din natin, kagaya na sabi ko kanina, ma-protection natin ang ating mga pamilya na mahawa. Kailangan maging malakas din tayo, malusog, malakas ang resistensya natin sa labanan ang mga sakit sa
Ayan. Doc, ano nga po pala yung mga natin, cosmetic surgical procedures here at Milarus and also at StemGenn?
Madami tayong mga cosmetic and surgical procedure, kagaya ng mga sinasabi natin before. Mga rhinoplasty, buccal patch removal. So, ano po ba yung mga ginagawa natin doon sa kabila?
Kaya kung may mga po kayo, mga nais po kayong itanong, you can message and type it in. Look for Dr. Rodante Miranda. And also, visit us here at Milarus Aesthetic and Surgical Clinic located at
Second floor, Caswin Building. Timogawin yung Quezon City in front of GMA 7 po. Pagtanong niyo lang po, si Ate Doc sa GMA 7, makakarating na po kayo dito.
si Doc M po. Okay. Second floor, Caswin Building, Timog Avenue, Quezon City, just in front of GMA 7, second floor.
Not
And-
inside the GMA 7,
Yes.
outside the GMA 7,
Across the street. Across the street. Okay. And also, yung amin pong bahay sa Angeles, Pampanga po, that is StemGenn Regenerative and Wellness Clinic po. Please do visit us if you need our help. Okay? So, ayan po. That's StemGenn Regenerative and Wellness Clinic.
Malapit po kayo dyan, pwede niyo po kami puntahan dyan sa Pampanga. Madalas din po kami dyan. So, every ano ba tayo dyan, Ate Doc? Every day.
Almost. Oo,
every day.
almost every day kasi bahay talaga namin siya. Okay. And then also, wag pong kalimutan if you'll be needing antigen swabbing and RT-PCR for your traveling and then medical use, you can contact Lab Next Door under Medics Health Corporation. That's Lab Next Door for antigen swabbing and RT-PCR. And if yung gusto niyo naman na walang bayad,
Hassle. Walang hassle. Pwede kayong puntahan ni Ate Doc sa yung Lab Next Door niya. So, pwede po kayo magpunta. Or kung gusto niyo po sa walang bayad, kagaya yung sinasabi ni Ate Doc, punta kayo sa mga government hospitals, mag-check lang po kayong pumila. So, yun po, dalhin niyo din yung PhilHealth niyo para siguradong libre po kayo.
Okay.
Kasi, syempre, hindi lahat po libre sa government hospital, meron pa rin itong mga consumables na pinabayaran. So, yung iba, huwag po kayo magagalit kung meron kayong babayaran kahit paano, konti lang naman.
Okay po, Doc. Okay. Sige, mga ka-wellness ko, let's meet again by next week, next Friday. Okay? So don't forget. And thank you very much for having us with you today here at V81 Radio. Don't forget now, okay? Download our free app. It's free now and free forever. That's V81 Radio Worldwide free app. Okay? Bye-bye. Thank you.
Manda, Mara.
Isang makabuluhang talakayan patungkol sa ating kalusugan, kaligtasan at kagandahan. Kay Ate Doc lang yan. Mga tamang kaalaman at napapanahong usapin para sa pamilyang Pilipino. Siyempre, si Ate Doc yan. Kaya mga ka-wellness, andito na si Ate Doc, Sheryl Palad, upang bigyan tayo ng tamang kaalaman sa ating kalusugan, kaligtasan at kagandahan. Samahan si Ate Doc tuwing Biyernes, 1 p.m. Philippine Time. Dito lang yan sa V81 Radio Worldwide. reaching out to Filipinos worldwide. The now of digital entertainment with studios in Manila, Bacolod, Hong Kong, and Los Angeles, California. This is V81 Radio Worldwide.
V81